Hand hygiene, an easy and effective way to prevent infection. May be infectious. Diseases can be transmitted through contact if hands are contaminated with pathogens, especially when they are soiled with respiratory, discharge, or fecal matters. Diseases include dysentery, cholera, hepatitis, influenza, and hand, foot, and mouth diseases can be spread easily. Observance of hand hygiene is the prerequisite of the prevention of the spread of communicable diseases. Using liquid soap and water or alcohol-based hand rub can achieve hand hygiene. Who should perform hand hygiene? Hand hygiene should be part of everyone's daily routines. You should always perform and remind your family members or people around to perform hand hygiene as well. When to perform hand hygiene? Although it is not possible to keep your bare hands free of pathogens, there are times when it is critical to clean your hands to limit the number and the spread of pathogens. When to perform hand hygiene? Although it is not possible to keep your bare hands free of pathogens, there are times when it is critical to clean your hands to limit the number and the spread of pathogens. Always remember to clean your hands in the following situations. Personal hygiene. 1. Before and after touching eyes, nose, and mouth. 2. Before eating or preparing food. 3. After using the toilet. 4. When hands are contaminated by respiratory secretions. Examples, after coughing or sneezing. When to perform hand hygiene? After contacting or handling contaminated or dirty materials. 1. After changing diapers or handling soiled items from children or the sick. 2. After touching animals, poultry, or theater droppings. 3. After handling garbage. 4. After touching public installations, equipment such as escalator handrails, elevator control panels, or doorknobs. Others. 1. Before and after visiting hospitals, residential care homes, or caring for the sick. 2. Anytime you find your hands are dirty, it is advised to clean hands with liquid soap and water when hands are visibly dirty or visibly soiled with blood and body fluid after using the toilet or changing the diapers. When hands are not visibly soiled, hand hygiene with 70-80 alcohol-based hand rub is also an effective alternative. How to perform hand hygiene? Steps for proper hand hygiene. A. Clean hands with liquid soap and water. 1. Wet hands under running water. 2. Apply liquid soap and rub hands together to make a soapy later. 3. Away from the running water, rub hands. 3. Away from the running water, rub hands, including palms, back of hands, between fingers, back of fingers, thumbs, fingertips, and wrists, according to Step 7 steps of hand hygiene techniques for at least 20 seconds. Do not rinse off the soap while rubbing. 4. Rinse hands thoroughly under running water. 5. Dry hands thoroughly with a clean cotton towel or a paper towel. 6. The clean hands should not touch the water tap directly again, for example, using a paper towel. To wrap the faucet before turn it off. Please note, never share towels with others. Dispose of used paper towel properly. Store personal towels properly and wash them at least once daily, preferably. Prepare more towels for frequent replacement. 7 steps how to perform hand hygiene. 1. Palm. 2. Palm. Back of hands. 3. Between fingers. Back the hands. 4. Back of fingers. Between fingers. 6. Fingertips. 7. Back of the fingers. 5. Thumbs. 6. Fingertips. 7. Wrists. Clean hands with alcohol-based hand rub. 1. Apply a palmful of alcohol-based hand rub to cover all surfaces of the hands. 2. Rub hands including palms, back of hands, between fingers, back of fingers, thumbs, fingertips and wrists according to the steps of hand hygiene technique. 3. Rub for at least 20 seconds until the hands are dry.